Hello, my name is Rob Durham,
And I'm John Chappell.
and you're listening to another edition of the Gyrolab Spin. On today's episode of The Spin, we're going to talk a bit about how the Gyrolab can be used to measure free analyte on the Gyrolab. We'll talk a bit about why you'd want to do that and give some great examples. My good friend and colleague John Chappell has presented on this topic many times, and he's kind of become our resident expert on measurement of free.
Yeah, I mean, this is very much a subject which is a hot topic for us at the moment. It's very much a lot of customers wanting to develop free assays. So we thought it was very important to do this podcast to really discuss this subject.
So the real question is, why do we want to measure free analyte? Well, it's important, I think, to understand the pharmacological effects of a therapeutic and understand the interactions between the biological drug and its target. We really want to understand fraction bound versus unbound, because it's our free drug which is the active ingredient in the situation.
I mean, it's an important part of understanding purely the pharmacokinetics and the pharmacodynamics. One of the problems is the actual assay to measure free can actually cause bias. So therefore, if you have any incubation of the interactant, so you can get dissociation as part of the incubation. Also, when you dilute, because many assays you need to dilute samples to get them into analytical range. By diluting them, effectively you can shift the equilibrium as you change the concentration of the interactant. So measuring free target or free analyte can be quite tricky in a conventional immunoassay.
Yeah, and if in the example shown here, where you look at the graphic below, you can see how the drug is at one equilibrium, and then you add it to this plate where there's a solid substrate of the target. You're going to see an equilibrium shift happen during that time. So the timing of that and any dilution that takes place before that is obviously going to disturb this situation.
So when we compare the Gyrolab versus a traditional analyzer, when you look at the flow-through technology of the Gyrolab, the actual incubation times as part of the assay will be in the seconds. So there's actually very limited time for any dissociation of complex. But when you compare that to a traditional ELISA, you're normally incubating for a minimum of 1 hour, the sample incubation. And during that assay step, when you're actually trying to pull down the free as part of the assay, you're going to get dissociation of the target and the drug. So this is the limitation, really. It's good. Yeah.
Right, and I think, it makes a lot of sense from a scientific standpoint, but still I think, when you're thinking about it, we think of the amount of drug that's bound to the target is a fixed thing, and it's a dynamic process, right?
No, exactly.
And so it's always changing, and then the minute you dilute the sample or you put it in a new situation, it's going to re-equilibrate, and that's going to affect the results, I think. So to help us to see how this works practically, we have this model system set up with VEGF and Avastin, and then we can use the same reagents in both the Gyrolab setup, where we biotinylated our capture reagent and Alexaflor labeled our detection reagent to measure the analyte in this free analyte in this process, and we can do that either on a plate in the gyro system or on a plate-based system which uses the HRP as the detect mechanism. So using this model system, we can then look at how the effect of time and incubation impacts our results. So if we take a look at the results from this experiment using our model system, you can see in this graphic the response of the free antibody versus the concentration of the molar target. And as you would expect, as you increase the concentration of the molar target, the amount of free antibody is going to decrease, and that's exactly what we would expect. But when you take a look at the details here, the gray bars are on the Gyrolab system with a very short incubation time. The red bars are ELISA with a 2-hour incubation, and the blue bars are an ELISA with a 4-hour incubation. You can see that that's where things start to diverge a bit. So now when we look at the blue and the red bars, as you increase the molar concentration, and we're trying to get at a lower and lower free concentration of our drug, we're starting to see some differentiation between what we saw with the Gyrolab and what we're seeing with the ELISA.
Yeah, so what that means really in reality is that you're going to overestimate the amount of free target so that's obviously going to make you misinterpret the data and the amount of free. This just highlights where the Gyrolab can give you an advantage. So for things with lower affinity, then any sort of dissociation that can happen as part of the assay step, then it's important. Then you're not truly going to have a measurement of free using the ELISA format.
Yeah, that's quite right. What this graphic is meant to show, John, is now we're switched to Lucentis as our drug that has a higher affinity, and the problem of the dissociation equilibrium shift isn't as apparent in this situation, because now as we increase the molar target concentration, we're getting a pretty much good agreement across all the different methods with the amount of free that's available.
So I mean, this just stresses how important it is to understand the interaction between your drug and your target.
Right.
If you know your drug has very, very high affinity, then the impact of assessing free is going to be less than if it's lower affinity. So this is where the Gyrolab can really be important, is that when the affinity is lower, then it's more likely to give a much better estimation of the free target.
And I think what we'll see in upcoming slides is how important it is from a PD aspect to understand the efficacy of your drug is often tied to how much free is available.
So in summary, plate-based immunoassays, traditional ELISAs, can cause an overestimate of free analyte, particularly for lower affinity interactions. So the flow-through delivery on the Gyrolab CD can actually ensure accurate free analyte determination because there's short incubation time. So this minimizes the equilibrium shift as due to the assay.
Yeah.
And also it does have high tolerance, allowing samples to be run at low dilutions, sometimes undiluted. And that bit we're actually really going to focus in the next few slides, where we look at an example where we looked at an assay where sample dilution that could cause an issue as well. But in general, Gyrolab assays are good precision and are very much good for doing regulated work. So it's very important. Gyrolab is a really good tool for doing free analyte measurements as part of drug discovery and development.
So now we'll shift to another example where we have some more detailed data to talk about how we can measure free IgE as a measure of efficacy.
So we're going to look at the interaction between IgE and a drug, omalizumab, which is a humanized monoclonal that binds to IgE. So this drug is used for treatment of severe allergy. So it effectively binds free IgE. So it binds to IgE and prevents the IgE interacting with mast cells and other immune cells, and then preventing hypersensitivity. So one thing is that free IgE is actually an important part of determining the efficacy of the treatment. So it's an important part of the pharmacodynamics. So the free IgE is it can actually cause downregulation of the receptors. So the free IgE is an important part of demonstrating the actual effectiveness of the treatment. And also can potentially, in the days now of biosimilars, it can be a way of proving biosimilarity when you're looking at reference and new originator versus biosimilar versions of the same drug. The important part of XOLAIR or omalizumab and IgE interaction is that the literature has reported binding affinity in the nanomolar range. So it's a relatively low affinity interaction. So therefore, potentially complexes may be dissociated by sample dilution or sample incubation. So the aim in this case was to develop an assay in 100% matrix. So by analysing in 100% matrix, you're causing any dissociation by diluting the sample. One of the problems is that if you look at the pharmacokinetics of the drug and then the free IgE concentrations, so when the drug levels are extremely high at the start of the profile, the free IgE concentrations are extremely low. But by the end of the pharmacokinetic profile, you get a rebound increase in IgE levels. So you go from very low IgE to very high free IgE. So to actually be able to do that in the same assay, it means that you cannot basically dilute the samples. So it means that we need a way of doing 100% matrix, but also being able to shift the analytical range. And we're going to talk about how different CDs with different sample volumes can be used to shift the analytical range.
Yeah, this is really where the Gyrolab comes into its own, given that you can, without diluting the sample, shift the dynamic range of the assay through several orders of magnitude.
Yeah, because we can go anywhere from 20 nanoliters up to 4,000 nanoliters. So there's a massive increase in the amount of sample that's actually added to the system. So when we actually look at the assay format, so that we used a biotinylated drug as the capture, and then we used anti-human IgE polyclonal antibodies detection. The actually assay format was actually selected. We also looked at a receptor assay as well, using the IgE receptor as capture. What we wanted to avoid was any different of affinity of the assay reagents to the actual complex. So by using the drug, we at least know that the drug has the same affinity as the drug in solution.
Right, and so just like we saw in the previous example, where a difference of affinity could have shifted the results one way or the other, made it very difficult to understand what the real drug target interaction was like in the samples.
Yeah, we felt that it would give more an accurate determination of the free by doing that. But so what we did, we actually set up the standard curves in different percentages of matrix. So in this case, we used a stripped matrix, so an IgE free matrix. To be honest, by stripping the matrix, you're removing interferences. So it's really only a surrogate matrix. But in this case, we managed to demonstrate that using 100% surrogate matrix, we got a good standard response, and as we diluted that, we got very parallel curves. So that was a good starting point for assay development. The next key was when we actually take serum samples, can we demonstrate parallelism and to ensure that we get accurate determination at 100% matrix.
Right. All right, John, so why don't you walk us through this first parallelism experiment, and you're using the 4,000 nanoliter CD, so maybe talk a little bit about why you picked the 4,000 nanoliter CD to start.
So the main sort of reasoning for picking the 4,000 CD for initial work is that during the pharmacokinetic profile, when the drug concentrations are really high, the levels of free IgE are extremely low, so we want really maximum sensitivity. So the 4,000 CD will introduce the most sample volume, so increasing the chances of measuring very low concentrations of IgE. But when we look at this parallelism data where we've taken normal serum samples and we've looked at the result neat compared to 1 in 2, 1 in 4 and 1 in 8, what we can see is a huge underestimation at the neat concentration. As we dilute the sample, you can see the IgE concentration is increasing, and it seems to be getting more parallel between 1 in 4 and 1 in 8 dilution. So what this would mean is that for this assay on this CD, you would need to apply at least a 1 in 4 or 1 in 8 minimum required dilution, which, as we know, would be unacceptable for measuring free, because we're likely to overestimate the level of free. So
it kind of puts you in between a rock and a hard place, right?
Exactly. And I mean, we do know that we need, for this assay, we need 100% matrix. So the next stage is we look at the viewer profile, which kind of tries to understand what is going on here. So when we look at the viewer profile, so the Gyrolab has the advantage of us being able to look at the viewer profile so we can see what's actually happening on the column. You can see with the neat matrix that the integration window, which is represented by the white sort of integration area, you can see that there is a lot of debris, or a lot of the sample is outside the integration area. Yeah. So this shows that with the 100% matrix, you're getting the actual sample flow is not, is not smooth, is not happening smoothly. And as you can see, as you dilute the sample, you can start to see the part outside the integration area is starting to decrease. So this really shows you that the matrix is actually causing a problem, a matrix effect in the assay. And this can really be demonstrated with the viewer profiles.
Yeah, I think the technical term for that viewer profile and neat matrix is ugly. That's an ugly peak.
That is an ugly peak. But when we tested the same assay on our high capacity CDs, we did find that the samples were parallel. So when we look at neat, between neat and 1 and 2, you can see here that all samples were parallel. And what we found is that the high capacity CDs were much better for 100% matrix. So at the time that we originally generated this data, the 4000 HC was not an available CD, but subsequently this has now been tested, and we've shown that the high capacity 4000 also gives us parallel dilution of samples. So the high capacity CD contains a different column, streptavidin column, so it's more porous beads. Yeah. And what we're theorizing is that the high matrix components tend to get trapped within the porous beads, and therefore we get better flow of the interactants over the column. So the high capacity certainly seems to benefit these assays where we want to analyze neat matrix. And we know from our customers that so many customers want to use neat matrix because they want to measure free.
Yeah, exactly. And I think, again, as we think about adjusting the analytical range of the assay, that's why people want to stick with the HC beads across all of them.
Yeah, so,
I think we'll see here it wasn't as critical for this particular assay, but I think, again, it's one of those discussion points that we have with customers.
Yeah, we have many customers that have requested the 200 HC CD, which is currently not available. So it's something that obviously we need to think about in the future. So what we did find is that with the lower volume CD, the 200 CD, that we did get parallelism. So there's obviously a matrix effect happening at the higher volumes. So we actually did get parallel dilution with the 200 CD. But as Rob was mentioning, people that want to switch CDs would prefer to keep the same column type. So it'd be better to have a 200 HC CD for when you directly want to move the assay between different CDs. So what we did find is that the high capacity CDs did suit 100% matrix, particularly for this assay. So the matrix components did produce less interference. We did need a specific method which increased the column wash after the actual sample incubation, but that can be discussed if you need this type of method. And as mentioned earlier, also the 4000 HC was also tested with good results. And what we can achieve by switching the assay into different CDs all the way from 20 HC all the way up to 4000 HC, theoretically we can have an assay range of low nanograms per mil all the way up to 240 micrograms per mil without diluting samples, which is the key.
Yeah.
So, and this is important part of why this assay would be suitable on the Gyrolab.
So we're really maintaining that analytical range without doing the usual trick that the analyst would do, is to dilute the sample.
Yeah,
right?
Which we know that if we dilute the sample, that would really overestimate the free component.
So we didn't show you the assay development on the 4000 HCCD, but here now with the 1000, we've got a comparison of a couple tables showing the QC samples for both the 1000 HC and the 4000 HC. So to walk us through this, John.
Yeah, so this just shows acceptable precision and accuracy. All the serum samples that were highlighted and used as QCs. So we screen serum samples, which is normal for a biomarker assay, to find low, high, and medium concentrations of IgE. What I'm not keen on is actually spiking QCs. I would prefer QCs to be reflective of the endogenous material,
right.
Particularly when you're doing precision and accuracy, because it's more reflective of the actual concentration, the actual what you're trying to measure.
Absolutely. No, this looks really great, and I think it just is a testament to how the hard work that you did to really make the HCCDs produce a really nice assay.
Yeah. So also as part of this project, we wanted to actually look at the calculate the affinity for the IgE and omalizumab interaction. So one thing that Gyrolab can do is we have an affinity module. And this affinity module allows you to do in-solution affinity determination. So this is in solution, and the good advantage of this is it's pretty good for high affinity interactions, but also good for low affinity interactions, and it actually measures things in solution. So it's more reflective of the biological situation, and you're also not labeling the actual interactant, so they're allowed to react in solution, so there's no modification. So it should be more reflective of the biological system. I suppose one of the things is that, like, the gold standard for affinity is to use surface plasmon resonance, which obviously requires immobilization of the reagents. So there's always an argument of how representative this is of the biological situation.
That's correct, and again, this really gives you a situation where you're measuring your affinity in a way that the drug in the environment in which the drug is really interacting in the body.
So we generated affinity curves to really characterize the interaction of XOLAIR and IgE. And what we calculated was a KD of XOLAIR binding to IgE in around the 20 nanomolar. So again, it shows low affinity. We did short incubation at 1 hour and overnight, and what we've shown really is that quite a short incubation gives you a quick determination of the KD value, which in this case is good. Obviously, if it had higher affinity, we definitely need to incubate for a lot longer. So for this system, it allows quite a short incubation. We also then looked at the assay. This assay was performed in buffer, and then we did a comparison into serum, which is on the next slide. So in this case, we calculated the KD in 50% serum, and what we've shown again is that we're showing KDs of between 18 and 30 nanomolar. So again, we're proving there's quite low affinity of the interaction, and it kind of correlates with what we're expecting. Following the affinity investigations and determination, we went back to the free assay. So what we've done is then take the serum IgE samples with an estimated concentration of endogenous IgE, and then we've spiked them with different molar concentration of XOLAIR or omalizumab. And what we've shown here is that we're getting a concentration-dependent inhibition of IgE measurement, which is what you would expect. So at very high concentrations of drug, you get a very low recovery of IgE. And then as you decrease the drug concentration, you can see an increase in the recovery. And what is quite important is that when you look at the concentration around 50 nanomolar, which is around the KD value, you're seeing around a 50% recovery, which is what you'd expect at the KD value. So this gives us real confidence that the assay that we are using is actually determining free IgE in samples.
Excellent. So in conclusion, this case study really showcases how we can shift the analytical range of our assay. We've got to work in neat serum, so we can't dilute the samples, so we can work in the 20 HC, the 200, the 1000, or the 4000 HC CD to shift that analytical range across a wide range of IgE concentrations in this particular study. So parallelism with the samples was solid, and this allows us to be certain that we can work in 100% matrix.
Yeah, and the good thing is also we're able to calculate the affinity as part of the project as well. So we know that we could kind of correlate with the affinity of the interaction, and to then kind of look at, you know, what impact that would have on the free determination. So I think that's an important part of the project.
So for further reading and viewing, if folks are interested in hearing more about the free measurements using the Gyrolab system, you can take a listen to this EBF talk, which was done in Barcelona in 2022. And then also there's a webinar that's available on the website, which highlights how Alexion have used the Gyrolab to measure free C5 for one of their projects.
Yeah, it really highlights that currently that there's a lot of people working on free determination, and Gyrolab is a useful tool to give accurate determination of free. And you know, please contact us if you want to discuss this, or you have any specific assays that you want to develop.
So that brings us to the end of our time. Thanks so much, John, for sharing some expertise on the free total measurements. As always, please feel free to reach out and let us know if you have questions.
Thanks, everyone. Please contact us if you've got any suggestions for future podcasts, or any comments or questions. Please reach out to us. We look forward to you contacting us. Thank you very much.
Until next time.
Thank you, everyone.